Hi there, I'm Jamie Taylor. Welcome to Your Health Matters, brought to you by Kingman Regional Medical Center, your community-owned hospital. Every week on this program, I have a different guest who talks about different healthcare services, programs, or issues that I think will be of interest to you and your family. So I hope you stay tuned because I've got a really exciting guest on the program today. We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Kathleen Burns, a nurse practitioner with Joshua Tree Pediatrics. Thanks for being on the show today, Kathleen.
Thank you, Jamie. It's a pleasure.
Good. And you're new to Kingman fairly well. When did you come here?
I just moved here in November and started working at Joshua Tree Pediatrics in December with Dr. Lafredo.
Great.
Who's one of the few pediatricians in Kingman.
One of two.
And she's wonderful to work with.
Great. Yeah, we've been blessed to have her on board, and now we're blessed to have you.
Well,
That's
thank you.
Awesome.
It's a busy practice.
Well, and of course, kids. I mean, I'm sorry. I had two, and then I had 4 grandkids. They're awesome, but I don't envy you.
Oh, no, I love it.
That's good, because it takes a special person. Well, it takes a special person to be in healthcare, period, and then to specialize in kids like you guys do, and you get all ages from what, newborn?
From 0, right? You know, we usually see babies right after 2 to 3 days after birth, and then we follow them until they're 18 or go to college.
Awesome.
So it's a variety, and it's a lot to learn because there's so many different conditions that go on with pediatric patients.
Absolutely.
But I love it. I love the well visits, you know, encouraging parents and children to have healthy lifestyles.
Sure.
And also the sick visits. It's a very underserved population here for pediatrics.
Yes, it is, like you said, with only 2, and now you'll be the 3rd healthcare professional that focuses, specializes in pediatrics. I mean, obviously, we have other healthcare providers who can see children, but that's not their specialty, and that's nice to have that as well. And now, I don't know if you even knew that Dr. Lafredo used to be over off of Eastern, and now she's moved over here, so it's a lot closer and easier for access to the hospital.
Yes, she mentioned that, and she developed this office in particular based on what she wanted for a pediatric office. So it's really set up to be kid-friendly, and the flow is very nice, and we have lots of nice well-lit exam rooms with lots of fun things for kids to do.
Oh, that's good.
So we try and make it a positive experience.
Because that can be kind of scary for a little one.
Yeah, because often they have shots and invasive procedures, and so we want to make sure that they're comfortable and happy.
Yeah, as much as they can be, or here's a sucker afterwards, right?
No sugar.
No sugar, oh, very good. Well, and I know that Dr. Lafredo kind of specializes in ADHD and children with behavioral problems. Now, do you do that as well?
I do. One of my interests is actually working with children with special needs from a biomedical approach also. So making sure that their nutrition's up to par, that they have certain supplements that are known to help children with ADHD and autism. And to reach out to the community for special services that they may need.
Oh, that's good. Because I don't know that, like, what kind of special services do we have that can help them?
They have the Arizona Early Intervention Program that helps with children with special needs and speech therapy.
Good.
Which helps, and then they have behavioral health services here also to help support parents.
And that sometimes they need it a lot, right? Well, that's great. And so do you find, like, a lot of your patients, are they diagnosed at birth with that ADHD or autism, or does that show up later?
No, sometimes it's not until, well, we start screening for it fairly early. At usually around 9 months, we start looking for developmental cues to see if they might be developmentally delayed, or if the parents has concerns about their interaction with other children, for example. So we start evaluating fairly early, and then if we do notice any behaviors that might signify, we will
early warning
signs. We'll start with special services. Sometimes it could be regressive, meaning a child is progressing along fairly well, developmentally meeting his milestones, and then all of a sudden stops talking. Or so that's one of the issues also that you're seeing with autism now.
I
it's
didn't
called
realize
regressive.
That. Now, is that something? I mean, is it it's not curable, right? It's more you can.
There are different theories about it. There are certain theories that show that children that have different behavioral modifications as well as diet modifications can recover and can function
better.
Better.
Well, that's interesting to know, though, that it's actually their diet can even affect that. And is that something that can also bring it on?
There's theories that say that also can bring it on. That a lot of, but most of it can be a genetic predisposition. So there's so many different theories. They think it's a combination of a genetic predisposition, maybe some assault to their immune system, plus some diet.
So all of that can play a part on that. So how did you get interested in working with kids? I got to ask.
Right after high school, actually, I became an LPN, and I worked with children that had, there were special needs children, tracheostomy, gastric tube patients. And so I did a lot of home health with those patients. And decided that I really, really enjoyed it. And so I went back, not until years later, and got my master's degree. And now I'm a master's certified pediatric nurse practitioner.
Awesome. And let's clarify for folks, because it's easy to say that. Not everyone may understand the difference between a physician, a physician's assistant, and a nurse practitioner.
Good question.
So let's talk about that.
So as a nurse practitioner, I started out as a nurse, so studying nursing and actually going through the theories of nursing and hands-on, changing beds,
the whole
giving immunizations, medications, and you learn about nursing theory and ways to support patients for health-wise. And you need to take nursing board examinations. And so that's the main difference. And a physician's assistant program usually is they're jumping right in. They don't have the nursing background. So they're studying, all the different systems and diagnosing and treating patients, but they don't have the nursing background.
And then also, though, a nurse practitioner can see a patient without a physician. I forget the word that they use.
Collaboration.
Collaboration.
So it depends on the state. In this state of Arizona, you do not need a collaborating physician. So I can practice, I can diagnose on my own, write prescriptions, and follow patients.
Where sometimes a physician's assistant needs to work under a physician.
Exactly. It depends on the state regulation. For example, I just moved from Nevada, and they just passed the law that nurse practitioners can practice on their own within the past 6 months.
Because before you couldn't.
And the state of Massachusetts, it's still a requirement that you have to have all your physicians sign off on it.
But you're working with Dr. Lafredo, obviously, but you're almost like a partner team.
Yes, exactly. And we bounce, when we have a difficult case, we bounce it off of each other and make sure that we're up to, speed on the latest protocols and what the best treatment plans are.
Well, I would think it's always sometimes if you've got someone that makes you kind of go, scratch your head, it's good to have someone else who, what do you think? Have you seen this before?
and she knows this community and the patients really well, too.
She's been here for a few years now.
So we are taking new patients. She
that's
wasn't.
Good.
She had stopped just because her panel was full. But now we do have openings for new patients.
That's really good for people to know, because I know I'd heard that out in the community from a few people. They're like, they're not taking new patients at Dr. Lafredo's office. Now what am I going to do?
Yeah, exactly.
So that's great news. We'll make sure and get that word out. I'm glad to hear that. So you are from New York, did I hear that right?
Originally I grew up in upstate New York. I went to undergraduate school in Rochester, RIT, which is Rochester Institute of Technology. I actually have an undergraduate degree in biomedical photography. So I used to.
Photography. So what were you taking?
So I worked in
pictures
a
of?
department. I would do PR. Also, I would do things like autopsy recordings,
Oh my.
slide presentations for the physicians.
Oh, okay.
But I realized that I missed seeing patients
Right. That.
face to face and hands on.
Yeah.
And so then I went back and I got my master's degree from Mass General Hospital
Okay.
in Boston. They have a NP program there,
Mm-hmm.
and I graduated 6 years ago
Okay.
with my master's degree as a nurse practitioner.
Very good. And so then, where did you practice there for a while before coming west?
Yes, so I actually ran a home health agency
Oh.
where we saw children with special needs.
Okay.
And so we provided nursing services for them in the home. Pretty high technically challenged children
Okay.
with ventilators, trach dependent, G
wow.
tubes.
Yeah.
So that's one of my areas of expertise also.
Okay.
And then I did research for a little while. So I
Okay.
did research on supplements, for example, how probiotics are really important for the health,
Yes.
especially with so many patients being placed on antibiotics, that we really need to replenish their good
Replenish the
flora
good stuff,
also.
yes,
And that
yeah.
long-term effects sometimes
Okay.
of, bacteria becomes resistant to all these antibiotics that we're
yes.
using. So that's one of my areas of
Very good.
interest.
So encouraging them to look
Yeah.
at alternative and get those probiotics back in.
Right,
there.
or if I do need to place them on an antibiotic, I make sure that we try the best that we can to replenish their flora with probiotics, their
Good.
flora.
Yeah.
Because there's a lot of great research out showing how important
Yeah.
it is.
Well, and I would think especially for little ones, if they start early with lots of antibiotics and issues, which I'm sure earaches to sore throats,
Yes.
they get that in their system, and then that makes them become more, again, what's the word?
Resistant.
Resistant to those.
Yes, I often when a parent brings a child in with an ear infection, 80% of those infections will clear up on their own within a couple days.
It's just kind of
so we do,
dealing with-
unless they're very sick, we do a watch and wait.
Okay.
And I'd say most of the time parents will report that it did clear on their own. So we do give it a chance to heal, the baby to heal on their own or the child to heal on their own. But I do always recommend probiotics if we do put them on antibiotics.
That's a good plan to have. So then you came west.
Yes.
Somewhere along the line there.
Yes. Then right after I graduated from Mass General, I had family in Tahoe area.
Okay.
So I moved there at that time, which is beautiful.
Oh, it's a beautiful country up there. Except this time. Well, no, this
Tahoe,
time of year right
California.
now it's not too bad either.
Yeah, they don't
'cause
have much
haven't-
snow now there.
Right.
Anyway, yeah. So then I moved there, and they did an outreach program for KRMC,
Okay.
and I looked at the community, and I felt that, and I visited, and I really enjoyed how beautiful it is here.
It is. It is. Yeah.
And
It's
and
different, obviously, than Lake Tahoe. But I always tell people green comes with a price. So
A lot of snow.
Yeah, I've come to like shades of brown myself personally.
Yeah. So that's how I ended. And then they said that they really need another pediatric practitioner here.
Right.
So
excellent.
I decided to
So
join the
here
team.
you are. That's great. Well, we're lucky to have you.
Well,
That's
thank you.
awesome. Like I said, and I'm very excited to let people know that you're seeing new patients now at Joshua Tree. That's huge. So back to, well, and I don't mean to keep focusing maybe on that, but the ADHD and autism, I think, are issues that are pretty. Well, number one, they're more prevalent, I think, than a lot of people realize. Not just in Kingman, but overall in our young people. And are there other things besides? I mean, you hear nowadays about how kids that were on Ritalin when they were young, and how much it impacts their choices as they get older. So, are there other options that you look at besides?
Well, one of the last things you try to do is put a child on a medication. You try, consistency in a family is very, very important.
Okay.
Setting consistent patterns in your day. Children like routine.
Right.
So if that's off, also we find that a lot of children are not getting the exercise that they need. They're not. They have a lot of energy. They're
Right.
made to run around
Yes.
and to to
Stay
be
busy.
outside.
Yes.
And so I really discourage parents from letting them play unlimited video games
Right.
and
Sit in front
unlimited
of the computer
television and to get outside.
Right.
And even after school programs now, I know we all probably remember we had a lot of them that we participate in, but now they're not so prevalent anymore.
Right. Well, we're going to take a quick break and then we'll come back and talk, because I think there are some good programs here in Kingman that we can talk about. So,
good.
We'll be back right after these messages. Welcome back to Your Health Matters. My guest today is Kathleen Burns, a new nurse practitioner here at KRMC in our Joshua Tree Pediatrics. Thanks again for being on the show, Kathleen. It's great to have you. And I'm excited, as we talked about before the break, that you're seeing new patients, Joshua Tree Pediatrics. That's awesome. Now, we focused quite a bit on ADHD and those types of issues for children. What other kind of specialties, or maybe not specialties is the right word, what other kind of health issues do you feel are pretty prevalent in our community that we should be looking at?
Sure. I think one thing is, of course, obesity, and that's so prevalent in the United States, and we're seeing it in infants now and young toddlers. You can see that they're actually having some issues.
So that's got to be dietary,
and lack of exercise.
Right.
I think it's because we are sitting in front of the television.
Right.
I do recommend that no one under 2 watches television. I know it's difficult for parents sometimes, but for reading development and language development and actually, meeting some of the milestones, it's so important for them to interact.
Absolutely.
Because you don't get the same brain development when you sit in front of a television.
Well, I've actually heard that, although we don't actually see it with our eye as we're watching it, but there's lots of images going on there that we don't even, flickering kind of things, that can cause more problems with kids with ADHD than
that they're overstimulated.
Right. Yeah.
The other thing I think important is for families to have at least one meal all together every day. There's research that shows that prevents obesity. It helps with bonding within the family, and it's a chance for everybody to get together and kind of go through their day. But there is excellent research showing that how important it is for that to happen.
Yeah, that makes sense.
And home
that's
cooking.
a simple. I mean, we're talking not spending a lot of money here.
No.
it's just changing a behavior.
Exactly. Because so many people have so many things, families are so busy that making that a priority has shown to be very effective in preventing obesity and also bonding in the family.
Sure. And I'm sorry, I interrupted you. I think you're talking about home-cooked meals, too.
Yes. And I think the other thing is we are just so inundated with foreign proteins and foreign foods and dyes and preservatives, and just getting back to the basic for food really has an impact on a child's health. For digestive issues, because we see
fresh fruits and vegetables, having a garden in the backyard.
Yeah, or even just buying fruits and vegetables.
Yeah.
But home cooked meals where where the food came from.
Yeah.
Because it's convenient, but long-term health effects are going to be devastating.
Yeah, and that's important. Again, it's a fairly easy fix. We're not talking a lot of spending a lot of money here. We're talking about, in the long run, I would think it's cheaper than prescriptions and numerous visits to the doctor's office.
Exactly. Yeah, and just I think that if you have a few good ingredients, you can make meals for everyone. And staying away from really high salty foods, dyes, lots of preservatives have shown to make. We have so many kids that have digestive issues right now.
Really?
It's probably our number one complaint in our office is digestive issues.
And that comes up as tummy aches?
Tummy aches and vomiting and
it's
reflux.
dietary.
And a lot of it, some of it is functional.
Yeah.
Sometimes they're not developed, but a lot of times it can be an allergy.
Right, okay.
Or to a dietary reason.
Interesting. And that's sad that we're seeing that at such a young age. Most of the time, you hope that you don't get that kind of stuff till you get old. Especially you said reflux. I'm like, good grief, that's something you expect to see in middle age or whatever.
No, a lot of babies that we see have that.
That's too bad. That's tough.
Well, I think a lot of that has to do with formula. I know it's important, but breastfeeding is still the most digestive protein or
it's kind of
nourishment available.
Yep, why God gave it to us. To use it, right?
Exactly.
If it's possible. Well, that's good to know, though, and I think those are good tips for people to keep in mind. find that something as simple as fixing a home-cooked meal and sitting down together as a family.
Exactly.
And like you said, I mean, I know we all have busy lives, and some of these young families, I know it's tough right now. They're working 2 and 3 jobs just to try to get, pay rent. But finding that time together is really important.
But luckily in this state too, they have a good WIC program.
We do.
The WIC program is excellent.
Yep.
Providing the right nutrition for parents.
Yeah, and that's important. So do you give like nutritional counseling when they come in? You help them?
One of the things we first do is look at their growth and development, and then usually I'll talk about nutrition. And see what they're eating and how they can vary it to make it a little bit more nutrition, but that's a very important part.
Well, and I think, again, we go back to the easy, but it is much easier to just throw a bag of chips, or popsicle or something like that at the child versus fixing
You have to be
kids.
clever. You have to be clever because kids pick out things. It's usually texture.
Right.
So I'll ask a parent, tell a parent, just, steam some vegetables, puree them in a tomato sauce, serve them with pasta, because all kids love pasta.
There you go.
And you can hide them in different things.
Sure.
And most children, if you introduce a new food to them every 3 days, they'll slowly take a bite, and then it shows that they will eventually pick it up. But it's just introducing them.
Sure. And again, it's, even as adults, we have that change. You want me to do something different? Oh,
Exactly.
So helping them through that process, teaching them at a young age that change is okay.
Right, and not starting out with really sweet foods, fruits and vegetables. And of course, once in a while a treat, but not your mainstay.
No, and of course encouraging water and
no juice.
Staying away from that, because I'm sure I've heard too how the bottles and where we put the baby to bed with the bottle and they end up with teeth issues and lots of different side
you don't
effects.
you don't want the milk or the juice sitting on their teeth very long. It causes pitting and issues with
long-term effects. So you see them from 0 to 18. So and we've talked quite a bit about the little ones. What about in the middle years? What kind of issues do you see coming in?
Well, one of the things that I've noticed is that there are so many children that come in, and parents that come in with the complaint that their child's been bullied, or the child's been bullied at school.
You hear about that in the press, but I don't see
and recently in the news you've heard about certain incidences where children retaliate with by terrible things, shooting and terrible things. But I think that's one thing that really needs to be addressed in a very aggressive way in the community and in the school system, is that when a parent does report, or a practitioner reports, or the child reports that they're being bullied, that it's taken seriously, and that it's followed through on, and that there's outreach programs that teach about that also, so that children are aware that it's not okay.
Right, both for them to do it, and that it's not okay for them to have that done to them.
Exactly.
That it's okay to say, hey, that's
to report
wrong. Yeah. There's a couple of agencies in town. One is Arizona Youth Partnership that I'm aware of, and the Boys and Girls Club also has a pretty good connection with other agencies to help kids at risk. So those are 2 outsources for families if they're not getting what they need from the school.
That's great.
But I think their first avenue is obviously to go to the resource officer at their school, because there is one at every school, is my understanding. But then if that doesn't work, then they need to reach out further and get help.
Yeah, and just that it needs to be taken very seriously now.
Yeah, I mean, I think in my book, it's a form of child abuse. I mean, it's child to child versus an adult to a child, but it's still abuse.
Yeah.
And you're right, it needs to be addressed. And if we fix it, I mean, we want our children to grow up in a healthy environment that's stimulating for them so they can be the best that they can be.
Yeah.
And if they're in an environment where they're scared, or they're not paying attention because they're wondering what's going to go on around them, or they haven't eaten well, so their minds aren't there too.
And it can cause PTSD also. There's so many, that it's very traumatic, and people, and children will recount it over and over again when they were bullied, and even adults that I know will talk about when they were bullied in high school or junior high or elementary school, how devastating it was. So.
Wow, and they probably at that time didn't really have the avenues, or it was just, oh, that's just kids being kids kind of thing, and not looking at the effects it was having on them. So I guess it's important, number one, to recognize that that problem's out there, to be aware of it, and then to take action.
Take action and
do
look at
something
the
about it.
resources that are available
Right,
if you're
yeah.
not getting the answers that
Yeah.
you need.
Well, thank you so
You're
much for
welcome.
being on the program today, Kathleen. I'll look forward to getting to know you better in the
thank you.
community. I know our community will want to get to know you better too. So I hope you enjoyed our program today, and stay tuned next week because I'll have another exciting guest on the program then.